A sinus infection, also known as sinusitis, is a condition characterized by the inflammation of the sinuses, whereas the common cold is a viral infection affecting the upper respiratory system. Symptoms of a sinus infection often include facial pain or pressure, green or yellow nasal discharge, and a decreased sense of smell, whereas a cold typically presents with a runny or stuffy nose, sore throat, and a cough. The distinction between the two isn't always clear cut, but a cold can lead to a sinus infection if the sinuses become blocked and filled with fluid, allowing germs to grow. Treatment for a sinus infection might involve decongestants, nasal sprays, antibiotics if a bacterial infection is suspected, and home remedies such as warm compresses, while common colds are usually managed with rest, fluids, and over-the-counter cold remedies. Individuals with allergies, nasal polyps, or a weakened immune system are at a higher risk of developing sinus infections. Here's a detailed exploration of the nuanced differences between sinus infections and common colds, providing insight into their symptoms, treatments, and risk factors. Causative agents, bacterial versus viral. When distinguishing between a sinus infection or sinusitis and a common cold, the cause of infection is pivotal. While both conditions can present with nasal congestion, coughing, and headache, sinusitis is often caused by bacteria, which leads to more persistent and severe symptoms such as facial pain, purulent nasal discharge, and possibly fever. On the other hand, cold symptoms are typically viral, milder, and self-limiting, resolving within a week or two without the need for antibiotics. In cases of a viral cold, you might experience sneezing, a runny or stuffy nose, and a sore throat. Presence of symptoms beyond 10 days or a worsening trend should raise suspicions of a bacterial sinus infection, prompting medical evaluation for potential antibiotic therapy. Nature of onset, gradual versus sudden. Sinus infection or sinusitis and the common cold are both upper respiratory conditions that share overlapping symptoms, such as runny or stuffy nose, cough, and congestion. One distinguishing factor is the nature of their onset. Colds typically have a more abrupt start, with symptoms emerging rapidly over a day or two. In contrast, sinus infections often have a more gradual onset, potentially developing over several days and frequently after a cold has begun to resolve. Sinus infections can also cause more localized pain and pressure in the face, especially around the sinuses, and symptoms may persist and intensify over time, unlike the common cold, which usually improves on its own within a week to 10 days. Identifying these subtle differences assists healthcare providers in determining the appropriate treatment, as sinus infections may require different management compared to a cold. Duration and persistence, weeks versus days. Sinus infections, clinically known as sinusitis, typically manifest with prolonged periods of congestion, facial pain, and thick nasal discharge that can persist for several weeks before improvement is noted. In contrast, the common cold generally resolves within about a week to 10 days. Cold symptoms, while similar in the onset with stuffiness and drainage, are usually accompanied by sore throat, cough, and body aches, but these symptoms do not linger as long. A key differentiator is the quality and duration of nasal discharge. With a cold, it often starts watery and becomes thicker, and perhaps yellow or green as the illness progresses, whereas with sinusitis, the discharge remains consistently thick and may be accompanied by a significant pressure or pain in the facial area, particularly around the cheeks, eyes, or forehead. Persistent symptoms beyond the typical duration of a cold could indicate a sinus infection, necessitating medical evaluation and possibly antibiotics for resolution. Character of nasal discharge: thick and purulent versus thin and watery. When differentiating between a sinus infection and a common cold, the character of nasal discharge serves as a telling sign. In the case of a sinus infection, also known as sinusitis, the nasal discharge is typically thick, discolored, and purulent, indicating the presence of an infection within the sinus cavities. This type of discharge can be yellow, green, or clouded, and is often accompanied by prolonged symptoms lasting beyond the usual duration of a cold. In contrast, a cold usually presents with thin, clear, and watery nasal secretions, which are the result of the body's response to a viral infection. While both conditions can cause congestion and discomfort, The nature of the nasal discharge can be a helpful clue in distinguishing between these two common respiratory ailments. Associated symptoms: facial pain and pressure versus generalized malaise and cough. When distinguishing between a sinus infection and a common cold, a key symptom to consider is the presence of facial pain and pressure that often signifies a sinus infection. This pain is typically localized around the nasal area, forehead, or cheekbones, and can intensify with bending over or head movements. In contrast, a cold usually presents with more generalized malaise, including a feeling of tiredness and weakness. Coughs are also prevalent in colds and may accompany a sore throat and runny nose. While both conditions can share some overlapping symptoms, like congestion and nasal discharge, the severity and location of facial pain, combined with the general systemic feeling, provide important clues for healthcare providers to discern between the two.